Hi there, Emily from ARC Seminars here, showing you another super useful Kinesio tape application for swelling of the hand. Oftentimes, swelling of the hand can be difficult to reach with your compression, but Kinesio tape works really well because as the hand and fingers are moving so much, the Kinesio tape gets a great chance to lift the skin and harness those mobility, that skin mobility to bring the lymphatic fluid from out the fingers and the hand back up the arm. So here I'm going to show you one of my favorite applications to use it that works super well in practice. Grab your Kinesio tape and your arm. So again, as before, what we want to do is use the Kinesio tape to move the skin on the hand, the fingers, and draw it up the arm here. So our anchor is going to go in the forearm, whereas the tape is going to go across the hand. So first things first, measure your tape. It should go from the top of the forearm across the hand like so. And cut it off. As always, round the edges to keep it from snagging and have it stay longer. I cut this in 4 tails. And if you're really organized, you can actually pre-cut a couple of these ahead of time so that as your patients come in, you can grab and go. Although once you get used to it, it really doesn't take that long. Take your Kinesio tape and round the ends. This is especially important when it comes to the hand, as it's more likely to get caught as your patient puts their hand in and out of sleeves, etc., etc. So prepping the skin and rounding the edges is going to be vital. As I always say, prep the skin, make it as dry as possible. So I like to use alcohol wipes or alcohol gel to dry off the skin and take off any excess oils. This skin is already prepared, but once you've used your alcohol and let the skin dry, you're ready to tape. After you've cut your Kinesio tape into those tails, I like to take off the anchor part. This gives you more control over your tape placement. We want to touch the tape as little as possible so it doesn't lose any of that adhesive. The anchor is going to go up on the forearm. Now, importantly, when you are taping for swelling, we don't want the tape itself to have any stretch. We want all the stretch to come from the skin. That way, when the person is moving around, the tape is pulling on the skin and mobilizing the skin, similar to the actions we do when we're performing manual lymphatic drainage. So stick that on well, rub it in to activate the heat and the glue so that the tape is going to really stick. Now you can put the tails on separately, which is going to make it a lot easier for you to do. So again, think about your skin stretch. The way we have the skin at most stretch here is to flex the wrist and flex the fingers. So have your patient do that motion and hold it that way. And begin to lay your tails down one at a time. You can pull the paper backing off. Allow the Kinesio tape to rebound a little. And then with no tension, lay the tape down over stretched skin. If you're going all the way down to the fingers, you'll follow this all the way down. Or if you're just going to the MCPs, you'll stop here. Take your next tail. And give it a rub to make sure that you're heating up that glue and that it sticks well. Taking taking your third tail and laying it down with no stretch whatsoever. And your last tail. And as you can see, taking the anchor off in advance and having those tails separated gives you a lot more control over the tape. It's not getting stuck to your fingers or getting tangled up in itself. So that is a good trick to have in your toolbox. Okay, let's give a rub, warm up that glue. And as always, what we want to see with our Kinesio tape is that it's lifting the skin. We want those beautiful wrinkles. That way, when the person moves their arm, the Kinesio tape is truly lifting up the skin and mobilizing it. So as you can see here, when the wrist is being flexed and extended, the Kinesio tape is working away and the patient is getting manual lymph drainage without the manual. So they're getting that lymph drainage just by completing their functional tasks. This is a very handy and one of my favorite applications for Kinesio tape of swelling of the hand. You can also, as I mentioned, bring it all the way down to the fingers. If finger swelling is an issue, you can bring it right down, or you can stop here at the dorsum of the hand and have it brought up the arm like so. If you want to see more of our Kinesio taping techniques, check out some of our other videos or arcseminars.net where we talk about all things rehab.